These are really lots of old pictures. My mom is Opal Benson, my sister is Flora Benson. Did you see these? It really started specifically with my sister because she was to follow us home in her car and she turned off. And we went back to get her and found her just sitting in the middle of the street, not moving. Something very big happened, a fire at my mother's apartment. It was then that we began to see some things were not happening as they should. It was much later that I found out that she had been driving without car insurance for 6 months at least. And her home got repossessed because she wasn't paying the note, and just all kinds of very small things that I wouldn't normally even check on. I began to see that I really did need help caring for them both. They said, how about Memory Care Home Solutions? Try them, talk to them, and they will help. I believe my first contact really was Steve Miskovic.
Hi, Steve.
Hi there, Sandra. How you doing?
Good to see you.
Good. My primary role is to work with the families that are caregiving for loved ones with Alzheimer's disease, dementia, or any type of cognitive impairment. How's your mom and sister doing?
Pretty good right now.
It's very individualized and specific to that particular family. Sandra's family, her mom and sister had a fire at one of their apartments. If we could have been involved earlier on, we might have been able to help them prevent that by recommending disconnecting the stove at that time or taking the stove knobs off if they really weren't cooking much. Being involved like that can really help that family ensure their safety.
They really were helpful in ways that family, friends, they don't understand what you go through as a caregiver. Steve was on top of all of that, and he met the needs before I even knew they were there.
When somebody from Memory Care Home Solutions goes into the home, they're giving many strategies that the family who's caring for the person with Alzheimer's needs to implement. And then we are actually tracking, we're calling them up and finding out how have you been able to implement the changes that we've recommended. And what we have found is that about 75% of the changes that we recommend are in fact implemented. So that's fantastic. That means that now they're sending their loved one to adult daycare. Now they're going out for lunch to take care of themselves. Now they have safety locks on their doors. Now there's a chime so that when the person leaves, they know and they're alerted to that fact.
I've had a dementia practice in St. Louis for over 20 years, and I've referred directly some of my patients to Memory Care Home Solutions. And unequivocally, they've been a wonderful organization, very personal, and have helped our families extend their time at home and improve quality of life with our caregivers and our patients.
And Steve's willing to step in to help however he can help.
Memory Care Home Solutions from the very beginning has networked with researchers at Washington University and followed their outcomes very closely.
There you go, Ma.
The outcomes that we think are important for care for the demented individual at home can include caregiver stress, decreasing financial burden, issues related to contact with physicians, trips to emergency room, phone calls to physicians, 911 calls. And across the board in all of these areas, they've shown improvement in all these parameters.
Memory Care Home Solutions has gone from serving 100 people to over 3,500 people. And there's no way that we could have done this without the devotion and the talent and the guidance of so many incredible people.
Alzheimer's disease and related disorders are very difficult. The impact that they make on our patients and families is huge, and it's overwhelming. And it literally takes a village to help care for an individual and the family through this process. So I would ask everybody to realize that sooner or later, if they haven't been faced with this disease, they will. And just, we all need to pitch in and help out in this situation and assisting our patients and caregivers.
There are 120,000 Missourians who are experiencing this, and there are 250,000 people who are caring for them. Let's help them.